Hey, welcome back. Today we'll be going over anatomy for beginners. It is going to be an introductory course, so just get the fundamentals of the different parts of the anatomy of the body, things you will hear in a yoga class or any kind of movement type of field. We will also go over a little bit of physiology, that way you can understand what is happening during certain movements. I'll try to make this as easy as I can so that you can understand and take away some things that you can apply to your practice. Who am I and what do I know about anatomy? So I have graduated from the University of Miami with a degree in biology, have taken courses in anatomy and physiology for medical students. I was pre-med for my time in undergrad. I also went back to school and became a nurse, and I currently work as an emergency room RN at a busy trauma center. I love learning about the body and how it works and how I can apply the different things that I learn to my practice. So whenever you're ready, have a seat, get some paper if you like, take some notes down, and let's get to it. So the absolute first thing to know is the anatomical position of the human body when it is described in science is with the human standing straight up, their hands with palms facing forward, feet slightly apart. So this is the anatomical position. You've probably seen little drawings, something similar like the Da Vinci drawing with circles and a square. So hands open. So you have the palms facing forward because if it was this way with the hands rotated, it would create an overlap between, there's two bones right here in the forearm. So having them open outwards allow these bones to not overlap. The first concept we're going over is planes of the body. So planes of the body is how the body is divided. So when they start talking scientific terms, you'll start understanding when you hear these words. So the first one would be the frontal plane. Now, the frontal plane, the way you would imagine it is if my body was to be sliced in this direction, so completely in half, through the crown of the head, through the entire body, this way, it would separate my body into two different pieces from front to back. That is a frontal plane. Now the next one is sagittal. Now sagittal will cut the body in this direction. So completely sliced in half, creating a left and a right. And now the third one is transverse. And transverse cuts the body. So you're gonna slice me in half, straight through the center of the body. So then there's a upper half and a lower half. And each plane of the body, there are different type of joint movements. So for example, in the frontal, you would generally have adduction and abduction. And we will go over these in a few moments, so just hang tight. In the sagittal, normally you would have flexion and extension. And in the transverse plane, normally you would have rotation. So we'll go over the different kinds of movements that are available to the body and see how it all fits into this. So now that we know the planes of the body, we will look at the types of movements that the body normally makes. We start with adduction and abduction. So those two, they sound the same, but as you notice, this one has a B. The easiest way to remember this is add. So this movement adds to the body. So your leg will be added to the center of the body. So you're adding, adducting, adduction. Abduction is taking the movement away from the body, away from the center of the body. So this is abduction, abduction. This is adduction. You're adding to the center of the body. So, and then, okay. The next movement is circumduction. So if you think about it, like circle, circumduction is a circle. You see it in the shoulder, and you will have it in the leg. You can have circumduction of the leg, circumduction of the shoulder. So just remember, like circle, and then you'll kind of get, oh yeah, it's circumduction, creating circles. The next one is lateral flexion. So this is a movement in which your whole body is moving laterally in the frontal plane. So when you are doing a pose like this, it requires lateral flexion. Your body is moving laterally. Laterally means side to side. The next one we're going to look at is flexion, extension, and hyperextension. So with these movements, they are very relative to the joint. So for example, here to this elbow, we are flexing and extending. Now, here we are flexing with the forward bend, and we are hyperextending when we go into a back bend. So when you think of the word hyper, you think of someone who's just extra and very energetic, or just beyond the norm. So when you think about flex, you think of these. You're flexing your arm, showing off muscles, and then extension is when you open it up. So flex closes the joint, extension opens it. Hyper is when, if some people you see it more, but their joints with hyperextension, it goes beyond the plane right there. The next movements are pronation and supination. Now, pronation is when you have your hand facing down. So like in downward facing dog, you have your hands on the ground, pronated on the ground. Supination is when your hands are facing up. So you can think of like when you're laying prone, you're facing downwards. So your hands are facing down, that's pronating, they're prone. Supination, they're facing up. When you're lying supine is when you're facing up. Supine, hand, supination. Now with depression and elevation, that you see it very clearly in the shoulders. So this is elevation and depression. So when you're doing your mountain pose, you want to Tadasana, you want to make sure that you have your shoulders depressed. You don't want them up here by your ears. The next one is dorsiflexion and plantar flexion, and those are regarding the feet. So sometimes you'll have a pose that say dorsiflex the foot. So when you dorsiflex the foot, it is saying that they want your foot to be with your toes coming towards your nose. And with the plantar flexion, which they won't necessarily bring up the word plantar, it might be just flex your feet. You will be just pointing your toes. So flex, you point, and dorsiflex, you're going to bring that toes to nose. Now, eversion and inversion, those are kinds of pronation and supination, but those are in reference to your feet. So eversion is when your foot is coming out towards the exterior. That's how I remember it. E for exterior and I for in. So with eversion, you're bringing the blade edge of your foot outwards. Doesn't go very far. And with inversion, you're bringing it in. So E for pointing towards the exterior, I for pointing towards the interior. Now, protraction and retraction. Definitely see this with the scapula, which is this bone right here. It's like a flat bone, so you can see it better on some people than others. But this one helps with movement. So protraction is when you're moving it out, and retraction is when you're bringing it back in. So protraction. So if you're throwing a punch, that is protraction. It's extending outwards. And then retraction is when you bring it back. You're bringing it back to the center. You're bringing it back into the body. And then rotation is when your body just rotates along the central axis being the center of your body. And we just rotate. If you need any more help, please let me know in the comments. Well, definitely, this can be a lot to learn, but these are things you'll definitely hear in classes. And especially with this dorsiflexion, like dorsiflex the foot, flex the foot. Some people will even go into terminology like adduct the leg, abduct, lateral flex, invert the foot. So you'll see that like Baddha Konasana. Some people are able to really bring that foot into like an inversion. So you definitely see a lot of these in yoga classes and other movement type of classes. So just getting to know these words will help a lot when you're going through your classes. I'm going to review two terms that are pretty fundamental when it comes to muscles, which is agonist and antagonist. So the agonist muscle is the muscle that is primarily doing the movement, and the antagonist muscle is the opposing muscle that is not doing any movement at all. It's actually in relaxation. So the agonist is contracting, the antagonist is relaxing. So two examples in the body that we see this happening is the biceps and the triceps. So biceps are the muscles here in the upper arm, in the front part, and the triceps are in the back portion of the arm. So as the biceps are contracting, the antagonist, which is the triceps, cannot contract. They both cannot do the same motion or contract at the same time. So for this motion to happen, or for the extension to happen, the opposite muscle has to relax. You also see this with the quadriceps and the hamstrings. Quadriceps are a group of muscles that are in the front portion of the thigh, and the hamstrings are in the back portion of the thigh. So as the quadriceps contract, the hamstrings relax. As the hamstrings relax, the quadriceps, hamstring contract, the quadriceps relax. So the way you would put this into your practice is, for example, if you were trying to open up the hamstrings, lengthen them out, get more flexibility there, you contract the hamstrings as you're doing your fold, your forward fold, and it will increase your flexibility with your hamstrings, because if these quadriceps are contracting, the hamstrings cannot contract. So it signals to the body that to let these go just a little bit more so that these can do the motion that we're trying, that contraction that we're trying to do. So keep that in mind when you're in your practice, the agonist and antagonist muscles. Put that to use for your practice in order to further develop it and expand it. So now we're going to talk about the muscle. The muscle is composed of many different muscle fibers. So this is the bone, this is the muscle itself. It's composed of different bundles, and each of the bundles have multiple fibers, and there's a single fiber, and inside the fiber it has different sarcomeres and all these technical words that create the muscle movement. But we are not going to go into the technical terms today. We're just going to go into the brief overview that the muscle is composed of many different micro filaments, and all of that together create muscle movements, contraction, and relaxation. So there's a tendon. The tendon attaches the muscle to the bone, and all of this is connected to the nervous system. So the nervous system is connected to the muscle fibers through these things called end plates, and this is much more microscopic than what I'm showing here. So the signal will travel from the spinal cord to the muscle, from the muscle to the spinal cord, and it regulates motion and any other things that the spinal cord needs to know. And from there, the signal gets sent up to the brain, lots of stuff going on. But the main thing that I want you to see here, when it comes to, especially with yoga, you want to stretch, get more flexible, is the muscle spindles, which are inside of the connective tissue. So connective tissue wraps around the muscle fibers. So there's muscle spindles, and then there's the golgi tendon organ, and those are usually in the tendon. So the muscle spindles, whenever it senses that the muscle is lengthening, stretching, will cause the muscle to contract, and that's where you get your stiffness. So it does that in order to prevent injury, to prevent you from tearing that muscle. Now, if you hold the stretch over time, the golgi tendon will tell the muscle to relax. So when it comes to flexibility, what you want to do is get into the pose very slowly and then hold it for extended periods of time so that your body tells your muscle to relax. So the Golgi tendon organ, or GTO, is the one that tells you to relax, and the muscle spindles are the ones that tell the muscle to contract while doing the stretches. Now, the contractions and other movements are dictated by other things within this muscle fibers. That is something totally different. But when it comes to stretches, the GTO will cause a relaxation after a period of time after the muscle spindle has told the muscle to contract. So times that you might see something like this is, for example, you step wrong, your ankle does one of those flap flap type of things. In order to prevent your muscle from ripping, the muscle spindle goes into action and keeps the muscle from ripping, and instead you might end up with just a sprain. So it's a protective way that your body uses these things in order to prevent injury. So all of these will go more into detail in a different video. For now, this is just like a little brief overview of the muscle and just these two. Good to know, and how to work with these two in order to increase your flexibility. So the last thing we're going to go over in this short little intro on anatomy is breathing. So yoga is a breathing practice, can't go without speaking about breathing. So the work of breathing is done by many muscles. We won't go over the details of them. This is a brief overview of everything. But so we have like the diaphragm, intercostals, abdominal muscles, there's 4 of those, pelvic floor, and then if your work of breathing increases or there's changes of movement, there's other muscles that help with that. So it'd be like the scalenes, the sternocleidomastoid, the serratus anterior, the pectorals. There's multiple pectorals. That may need to have other things going on to stabilize, so you'll need the trapezius, latissimus dorsi, the erector spinae, the quadratus lumborum. So there's a lot of muscles involved in breathing if needed, but the main one is the diaphragm. So the diaphragm, it looks kind of like a parachute or like one of those jellyfishes. It cuts through the center of our torso. So it's in its relaxed position. It is positioned kind of like a dome, like an umbrella. And the way breathing works is the diaphragm will contract. And when it contracts, it pulls everything down. And when it pulls everything down, it pulls the lungs with it, which creates a negative pressure. So essentially, when this contracts, it pulls down the lungs, it brings in the air. So this fills up with air, and then when you exhale, or when it relaxes, the air releases. So breathing does cause a 3D change to the thoracic and the abdominal cavities. So when you breathe, things are moving this way, they're moving this way, they're just moving in every direction. So it does cause a 3D change, and they call it cavities because this diaphragm it's the middle point in between the two. There are a cavity here for the abdomen and one for the thoracic, and it is encapsulated. So there's like a membrane covering. So everything's kind of like a compartment for the thoracic, so the upper portion, and a compartment for the abdominals. So that's very brief how breathing works. We'll get into more details in a whole other video, but just know that breathing does take the diaphragm as its main muscle, and if needed, multiple muscles, many muscles come into play. The reason so many muscles are needed as basically backups in case the diaphragm isn't doing what it needs to do effectively is because breathing is so vital to the body that it needs backups and backups upon backups and just different things just to make sure that we continue doing so. Because we can't breathe, we can't live. I hope you're able to take away something from this video today. It is the first of a series of anatomy videos, and I will be making anatomy videos breaking down the various yoga poses. So make sure to subscribe, like, and comment if there's a specific pose you'd like me to break down. Thank you so much for your time, for being here. Namaste.